Tonight on Lowdown, we'll take a look back at our interview with the University Health Center. We'll learn more about Big Pink Volleyball and talk with the organizers of the on-campus student pantry. All this coming up next. Hello and welcome back to Lowdown, a show by the students of the University of Central Missouri in Warrensburg. I'm Kylie Daniel. Thanks for joining us this evening as we continue to dive into all the cool things happening here at UCM. Speaking of, let's take a look back at our interview with University Health Center here at UCM and the procedures taking place with the COVID-19 pandemic. Hello, we're here today with Diana Herman to talk to us about the Health Center. So, can you tell us a specific role that the Health Center has for students on campus?
Are you referencing COVID or just in general?
Just in general.
Just in general. So lots of roles. Probably the number one thing that we see students for is acute healthcare needs, which for this age group is usually things like sore throats, flu, strep throat, urinary tract infections, bronchitis. Those are the most common reasons. But then we see things that affect students in this age group too, like appendicitis, kidney infections, kidney stones, abdominal pain, headaches, some trauma. Of course, if somebody's injured badly, they're going to go to the emergency room. Yeah. But we might see them later after a car accident or after a fall. I failed to mention earlier that we do a lot of women's health. We do contraception, STD testing for men and women, and treatment, as well as education. Let's see. A lot of depression, anxiety. We see a lot of students for depression, anxiety. Probably about 1 or 2 a day. That's gone up over the last 5 years. We've always seen students for that, but I'd say there's been an increase in the amount of students that are struggling with that. So we have good providers to help with that. We've got a great team of nurses and a great team of staff over at the Health Center. I really like how interested they are in students and how accommodating they are to try. They really are interested in students' health and them being able to succeed in college.
How would you describe the change you've seen recently from the pandemic in your role at the Health Center?
Well, there's been a major change and a major shift. We saw this coming back in January and started preparing at that point in time. And as everybody knows, there's been lots of changes that have happened since January. Yes. So a lot of the mitigations that we started last February and March, some of those are still in play, and then some of that has changed since then. So about spring break time is when everything went to mainly telehealth, and most doctors' offices were not seeing patients in person. They were being screened for infectious disease. And luckily here in Warrensburg, our hospital, Western Missouri Medical Center, they quickly responded by setting up a tent for testing, and they allowed us to use it for our students, so that worked out really well. So we were able to send students through a drive-through testing site, and then they got right back to us with results, and then we managed students on campus. As things progressed, we were not seeing that many in the spring and early summer. There was a spike in July, and then another spike right after school started. As things have progressed, we have taken on doing more of a public health model, as opposed to seeing every patient, having an office visit where you come in, you see the provider. We've changed to doing a lot of it by telephone and doing where we set up a communication tool so that students could let us know if 1, they thought they had symptoms, 2, they thought they'd had exposure, or 3, they've been tested and had a positive result. Then they could contact us through the communication tool. And we got back to them, and through that we were able to, 1, if they had symptoms, send them for testing at Western Missouri without an appointment, without the cost of an appointment, and without the delay of waiting for an appointment time. So they were able to get over right away and get tested. And then we follow up with them on a routine basis to see how they're doing with their symptoms.
Do you guys still have anything face-to-face option, or is it completely online?
Yes, starting around March when everything went to virtual. But since school has started and since we've learned more about COVID, we've gotten more used to managing it and feeling safer in how we manage it. We're now seeing quite a few more patients face-to-face for non-infectious disease things. So if somebody calls and they have fever, sore throat, cough, we send them to get tested before we see them at the health center. And we treat them over the phone. I mean, we're not gonna, if somebody's getting sick with it, then we're going to see them. We're going to arrange for a different process. But as long as they're managing okay at home, we just keep tabs on them. We did in the beginning, we took students' thermometers because we had them available. Then we went through all the thermometers that we'd ordered ahead of time and couldn't get any more, and there were none to be had in town. Yeah. And we would take students' Tylenol or thermometers and mainly just manage through calls to check to see how they're doing. One of the questions that we ask is, are they experiencing trouble with depression or anxiety related to being in quarantine or isolation? And quite a few students say yes to that. It's been difficult for them. But for the most part, everybody's managing okay. Everybody's really been good to work with. They're always, for the most part, everybody's been really nice when we call them and forthright. And it's been a fun way to be a nurse and to communicate with the students.
Can you tell us about your specific role at the health center?
So I'm a nurse practitioner, so I do see patients, and I see that as my number one role. We didn't have a director when this all started, and we needed to have a director during this time. So I took on that role for until we do get somebody hired in that position. So I've been leading the clinical aspects of this at the health center.
Do you have any advice for students to try to stay healthy and proactive in preventing this?
Yeah, and it's the same thing you've been hearing over and over again. Socially distance, staying at least 6 feet away from others, wear a mask, wash your hands. But even more importantly, those are very important things. But as far as overall health, getting enough sleep. I think that's the hardest for all of us. It's especially hard for college students because their hours tend to be sporadic sleeping. They might not get to bed until 2 o'clock, and they might get up for a class at 7, and they know they're going to be able to take a nap. But getting regular sleep habits is really good for your immune system. It's what keeps you strong, keeps you healthy. So sleep is key. And also eating healthy, drinking plenty and getting enough rest right now. When you're sick, staying home and not exposing others, and also not trying to overdo it. Because we're used to, in the past, I've seen college kids do it, I've seen lots of business people, they're so, I don't want to say addicted to their jobs, but they're so, they go to work every day even when they're sick, and they wear themselves out. And I have seen people get very ill from a virus because they didn't take good care of themselves and let their immune system fight the virus. So it's really important when you get the flu or when you get COVID that you rest so that your body can fight that virus. Viruses can be really mean. They don't know how much COVID affects the heart and lungs. Dr. Glover, he's our director for the University Health Center. He's the medical director for us. That just happened this year. But he's also works with all the athletes, the physician for the athletes on campus, and he's done that for years. And he's also a sports medicine physician and is very proactive in research with what needs to happen with athletes. So with all the collegiate athletes, they are being evaluated after they recover from COVID. They're putting them through a return to play exercises to make sure, and they're getting an EKG on them. They're doing some cardiac blood tests on them to make sure that they are okay to go back to their sport and to go back to that kind of strenuous activity. And I really applaud Dr. Glover for taking such a proactive role in that. So then when we have students that are in classes like scuba diving classes or intramural classes, because a lot of our students are athletes, even they're not collegiate athletes, that we can adopt some of those protocols to use for those students as well.
So can you tell us a little more how you try to keep the students to feel like they're in a safe environment whenever you guys are communicating with them?
Sure. So when you're talking about a safe environment at the health center, one of the first things that comes up is privacy and HIPAA compliance, and we are very, that's something that's at the forefront of our minds and has been for 20 years, is that it's really important to protect people's privacy. So we go to strong lengths to make sure that that happens. Then as far as the physical environment, we're doing increased cleaning now, but we've always been kind of clean fanatics, especially with flu and other contagious diseases. So we wipe down rooms with a antibacterial solution. We wipe down the tables and the doorknobs and the tabletops after patients that have infectious disease type ailments. We are using a COVID tent. Have you guys seen the COVID tent that's outside our building? So the reason for that is that people who might have infectious disease, we don't know if they have COVID or not, that the concern is that it is aerosolized or in the air. We know that it's in big droplets too, but it also has some aerosolization. And when you're doing a COVID test, you have the potential of making somebody cough or gag, and then that's more likely to aerosolize the droplet. So we have a COVID tent outside so that it's carried away in the air instead of being stuck in a room that's in the air that you can't wipe down. So that's been working out well for us, but it's not winter yet. It's not icing yet. The big windstorm that we had last week blew our tent down, broke one of the legs. We've repaired it, and we're looking for some better solutions for that. But that has worked well for us. It gives some privacy to the student, but also lets the airflow go through in a safe manner.
Do you guys have a plan in order for spring semester yet?
Pretty much to continue as we are. We're hoping, we don't know when we're going to see another surge. We saw a surge right after school started, and we made it through that, and we've gotten better at what we do, so it'll be easier the next time, I think. I'm hoping that it's not any greater surge than what we've already seen, but time will tell. I think it's going to be really important for students when they go home for Thanksgiving break that they don't take it to their families. Yeah. And so by that, the most important thing that you can do is to socially distance, to really be careful that 14 days before you go home that you haven't been around anybody that has COVID. And for the most part, when we do contact tracing, we have not found that anybody has obtained COVID in a classroom setting, because the classroom settings, everybody's remained 6 feet apart, and people are wearing masks. So COVID is being passed to people usually socially. It's usually family situations or friend situations, social settings where masks and 6-foot distancing isn't happening. So I'm glad that school stayed open. So many people are so glad to be back here. So I'm glad that the college opened, even though we were in a red zone at the time, and I was thinking, this might not be the right time to be coming back. But they did, and it's been good for a lot of students. And for the most part, people are doing what they need to do, and we've been able to continue our lives as normally as possible and dealing with COVID at the same time. And Dr. Best and the administrators that made those decisions, I think they ended up making wise decisions that were best for students and best for the Warrensburg and best for the university. So that's worked out well. I hope it continues like that. The one thing that'll change in the spring is we will have vaccine available. I'm sure we will have it available by spring. And the university may be one of the places, because we have nursing students that help with flu vaccine every year on campus. They have agreed back in the summer, the nursing faculty, that yes, they want to be available to help with doing COVID vaccine for our community. So we work closely with Johnson County Community Health, but I foresee that a lot of the COVID vaccinations, that there will be an increased surge in people wanting, and I hope there's a good surge in people wanting that vaccine, and we're going to be prepared to help give it. So that'll be a big change in the spring.
All right, do you have any advice for the students other than what you've already mentioned?
I think I did want to mention about contact tracing, that some students have been reluctant to name names, and I wanted to reassure them that when we ask for names, it's not I think they have a fear that they're going to rat out their friends, or that they, and I just want them to know that the reason we ask for names is so that we can contact the person that's been exposed and let them know that they've had a potential exposure to a person positive with COVID, and that they need to quarantine for 14 days. And that quarantine is important to protect other people, and that's how we're going to keep it from spreading to everyone in our community. So that 14 days of quarantine is important. And when we call, we don't mention who the person was that exposed them. We just say that you've been named as a contact on this date, and that you need to quarantine for 14 days from this date. So it's just how contact tracing works. And I know a lot of people see that as as their liberties being infringed upon, but you've got to keep the public. This is a public health crisis, and so we're not like some countries where they're watching to see if you leave your house and put you in jail if you leave your house. It's not like that. But in order for us to be a free country, we have to abide by public health laws and rules and infectious disease science.
All right, well, thanks for joining us, and you've been very informative, so thank you.
You're welcome. I hope this works out for you. Thanks.
We're here with Peyton McQueen to talk about Big Pink. So can you tell us what Big Pink is and how you guys work with that on campus?
Sure. Essentially, Big Pink is a student-ran committee that is aided by the Fraternity and Sorority Life group here on campus. Every year, this committee gets together and we come up with a plan of events. Sometime around October, the week usually changes. It can include fundraisers, information nights, really anything you could think of. But it all leads up to a volleyball tournament at the end of the year, and all the money donated goes towards the Johnson County Breast Cancer Research Foundation.
Okay, can you tell us your involvement in Big Pink?
So last year I was the head of marketing. I would aid in coming up with things to sell for the organization. Like this mask I'm wearing here was one of the items that we tabled. We typically table outside of the union for students to come see, and we have buttons and different things like that. This year I'm the co-chair, which just means that I help bring together the committee. I help decide where people need to go, what would be the best options for us. Specifically now with COVID, it makes things a little bit more complicated. So we need, all the minds that we can get to make sure that we have a smooth and good event.
So how many people do you usually have on your chair, like deciding and making decisions?
So typically there's usually only one student chair, but because we're getting a new grad assistant this next year, they thought it'd be important to have another chair who couldn't be with me today. But I think that's also going to be very important in making a plan of action for COVID, because it kind of hit us like a train this last year, as it did with every student organization in the entire world. So I feel like having another student chair will help us be much better prepared.
So how often do you guys usually meet for this event before it actually happens?
We typically meet once a week, usually starting in November, every Monday up until the event, and then a few weeks afterwards.
So how can other students get involved in Big Pink?
So other students can get involved by, if you're a part of a registered student organization, you can sign that organization up to play in the tournament. You can participate in any of the information nights, any of the trivia, any of the events that we have planned throughout that week. None of it is exclusive to any other group on campus. Anyone is welcome to join.
So how long have you been involved in Big Pink?
1 year.
1 year. So what would you say is your favorite part about Big Pink?
I think the best part about Big Pink, and this goes for a lot of other student organizations too, but what makes this great is that you're able to build a pretty good connection with people all across the spectrum of organizations on campus, and especially Greek lighter organizations. and it's always good to work with people from across the table.
What would you say is the biggest challenge in getting this organization up and running?
Well, like I mentioned earlier, COVID-19 has been the biggest struggle. It adds a lot of hurdles in terms of, okay, how do we space out these events? Do we have them indoors? Do we have them outdoors? How are local businesses going to respond to that? How are other student organizations going to comply with that? And it also has to do with, those organizations' own COVID-19 policies, because oftentimes they differ from the policies that the school has or the CDC has. So getting all of that in order has probably been the biggest struggle so far.
What made you get involved with Big Pink?
Well, personally, breast cancer kind of hits me personally. My grandmother was affected by breast cancer not too long ago, and when I was growing up. So I think it's very important to help raise awareness for breast cancer, and I think it's very important to not only raise awareness, but take that awareness and take that thinking into action and really raise money and put that effort towards something that will really help these people affected.
Thanks for talking to us and informing us about Big Pink.
No, thank you for having me.
My name is Allison Mines. So I've been coming to the pantry all 4 years that I've been here at UCM. My first year I was living in the dorms, and I didn't go quite as often, but every once in a while just to kind of get desserts or whatever. But as I've moved off campus, I come regularly, like every week.
The campus cupboard's great. We help a lot of people. It's free food for any faculty, staff, or student, and there's no stigma coming here. Like, we don't judge anybody for coming here. We have a variety of food, from cakes, pasta, soda, anything. It just depends on the week, but we highly recommend people come here and take advantage of the cupboard. This semester is a bit different than last semester because of COVID, obviously. Last semester, we let people come in to the cupboard and pick out their items themselves, and then they'd kind of check out at the desk with me. They'd kind of like show me their items, and I'd tally them off. This year's a bit different because we just have them go to the whiteboard and tell me what they want, and then we run back and grab it and give it to them. So it's a bit different.
So there definitely has been a lot of changes with COVID. We, over summer, saw this outpouring from the community, giving us resources here at the cupboard where we could take as many as we could of pretty much everything, and there was produce daily and all this stuff because so much of the community was supporting.
So it varies from week to week, but we have a regular selection of meat that's frozen, various kinds of meats. There are also some vegetarian protein options. So we try to have everything in the food groups.
So the main things that I like about the cupboard is that it's free, first of all, for all students here at campus. The staff is really great, and that there's a pretty big variety of all the food that's changing throughout for options.
What I like most about working here is just I get to help so many people. We, on average, I'd say we serve about 150, 200 people a week. So we serve a lot of people here on campus.
If you want to help, you probably can. There's probably a good chance there's something for you to do. We have volunteers in there right now. We get large boxes. There are 2 boxes. They're just full of chicken noodle soup. Big, huge bags of chicken noodle soup. And they are pouring them out into little containers and freezing them. So we have perfect portions to give people.
The people that work here are great. My coworker Josh, he's fantastic. We have a lot of volunteers that come through during the week. They're all great. They volunteer their time either for a class or if they just want to volunteer. And we have them repackage food or just clean up a bit, so everyone helps out a little. I remember my first week here, I actually had a woman break down in tears because of all the food we were providing. She didn't know where she was going to get groceries, and that was just really fulfilling to see. So I highly recommend this job.
So I highly recommend the cupboard to anyone, regardless of where they are at UCM, what grade level, if they're seniors or freshmen. Anytime I meet someone, I'm always have you heard of the cupboard? This is amazing. Just because when I was a freshman here, it wasn't really talked about at all, and no one was coming. It's changed now where On Wednesdays, I have like upwards of 100 people sometimes, but I still do the best I can to like kind of get it out there because it's such a beneficial resource here on campus.
The campus cupboard is open Wednesdays and Thursdays from 3:30 to 6, and on Sundays we changed the hours a bit from 3:30 to 5, and we're located downstairs at the Student Recreation and Wellness Center.
I hope you enjoyed that glimpse into university life here in Warrensburg. Unfortunately, that's all the time we have for tonight. But don't fear, the show in its entirety and individual segments can be found on our KMOS TV YouTube page. Thanks for joining us this evening. I'm Kylie Danek. Good night.